You're listening to the Yoga Medicine Podcast. I'm your host, Rachel Land. This podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts Tiffany Cruikshank and Katya Bach as we dive into all things yoga, research, and wellness.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.
Welcome to the Yoga Medicine Podcast. Thank you so much for taking the time to talk to us today.
Thank you, Rachel, for having me. It's an absolute delight.
I'm actually really excited because you are the perfect example, really, of what we work towards at Yoga Medicine, in that you're taking the very best of Western science and also the kind of wisdom that humans have curated and gathered over generations, as they have with the South Asian tradition of yoga. So I'm really excited to kind of question both of those brains today.
Sure. For me, yoga was never a thought before I had experienced yoga. Basically, meaning I was never exposed to yoga. I grew up in an Indian family, although I never lived in India, but I lived in Indian communities in my own bubble in, say, Saudi Arabia and England, but there was never talk of experiencing yoga, doing yoga, or going to a yoga studio. It never occurred to me until I had my first son, and I was driving through a yoga studio, and I thought, well, I do have this back pain, and I've heard people say something about yoga. Let me just walk into the studio and see what they have to offer. And I mean, since then, it's been a history. But it was, when I reflect back on it, I think it's interesting. Yoga comes from India. It's an Indian tradition. I come from Indian parents who grew up in India, but no, yoga was never discussed with me. It was never a topic with me. There was never a consideration of doing or exploring yoga. And that's mainly because I come from a Muslim family, a Muslim tradition, where yoga is considered a Hindu practice, right? And yes, yoga does come from comes from a Hindu philosophy, but it didn't mean that I couldn't practice it. But for my community, it was something like we shy away from or we stay away from it, right? And but what I appreciated yoga in the West was there were certain elements that were taken away and it was made more relevant to the community, to the Western community. And of course, there are studios there where there's more philosophy-based yoga practices. And I couldn't connect with those studios. And, they had their own, of course, their own value to the community, the benefit to the community they were bringing. But to me, it wasn't where I was feeling comfortable. But in spaces like where I trained, had my yoga training, or Tiffany's own Yoga Medicine, I felt like, okay, this is where yoga feels more relevant to me, and especially with a science background, and the way yoga goes into the anatomy and the science behind it. It was totally resonated with me. So, over time, it felt like if I am so much benefiting, if I'm appreciating this so much, there are women like me, who also need it, but they don't know, right? And I had never met before. And they may have been, though. It doesn't mean if I haven't met them, they weren't there. A hijabi yoga woman, a yoga practitioner, a yogi, right? And so I, as a hijabi woman, a woman who covers and practicing yoga and bringing it to my community, making it more relevant for them, right? And so, and women are, are caregivers, right? And they devote their lives to being caregivers. And they have, I think they have so many needs that, as from the outside, I can see that I can say, hey, I can help you with this, right? It may not take all your problems away, but I can show you something that I like to put in your toolkit you can explore at your own moment and time. And so when I saw, Rachel, that I was kept on talking about yoga to people, even though I was not even a yoga teacher, I had, I didn't probably watch any teacher training videos, nothing, right? I would practice. And I would find myself, hey, you have low back pain. Would you like to consider this? Oh, you're having shoulder pain. Would you like to try this posture? Or maybe you need to observe how you're walking during the day. And when I started talking like that, I felt, ooh, I'm talking a bit too much, and I don't have the expertise, and I should go and explore this teacher training option. And a time came in my life that I had the opportunity to do so. And I did it. And has been, I would say, a life-changing moment. And I have to thank the support of my family for enabling me to take that training. But since then, it's been no stopping. And I think that's the path that led me to where I am today, because that peeled the onion, the layer of the onion. It's like, okay, there is more to pain management than just medicine, right? So I was a pharmacist already. So when I did yoga teacher training, okay, the things I can do, certain postures I can do, certain flows I can do that help me alleviate pain. Okay, what else can I do? And I realized there are dietary factors that can help with pain. Oh, okay, there's psychosocial factors that can help with pain. Just yoga was just like one facet of my appreciating holistic lifestyle. And it's just been growing.
That's such an exciting beginning to the podcast. I feel like we could have a whole episode on a number of different things that you brought up there. Firstly, that there really is nuance to the conversations that we're having in the yoga world at the moment around representation and inclusion and cultural appreciation. Because for a lot of my students, even though they're not Muslims, their experience is similar, that if there's a practice that is really heavy on philosophy, it makes them uncomfortable, or makes them nervous. Whereas if we can find a nice balance for each student, then they're able to take the benefits of the practice and maybe create space for curiosity around the rest, or maybe not. And I think that's why it's so important that there is a really wide variety in teachers and teaching styles and practicing styles, so that everybody can access the benefits of yoga.
But yoga has so much to offer. Yes, so much to offer, so much to give. And then, of course, you can tease out what is relevant to you at the moment, and leave behind what may not be serving you at that moment. Right?
That's right. Knowing that your needs do change over time, and you never quite know where the journey will take you. So we could do a whole podcast on that, but we won't. And then I also wanted to talk to you about yoga teacher training, because I know how terrified I was going into my teacher training. And even though I knew many of the other participants, and it was at a studio that I'd been to, I still felt so intimidated. I had the wrong clothes, and I didn't use the right language. I hadn't heard of any of the teachers. So I'm curious as to what the experience was like for you. I'm guessing there weren't too many other hijabi women in your yoga teacher training.
No. So thank you for asking that question, actually. It's a good question, because when I think back, I think to myself, what a brave person I was back then.
Yeah.
Right? It's kind of empowering. So yes, I was nervous, and I had there will be men in the class. There will be lots of touching, right? So there's lots of feeling, touching, because we partner up with people. So, and there will be will men touch me? I was afraid of that. My attire, right? What will I wear? How should I dress? If I say no to a certain pose, would that be seen rudely? So say if there was, I didn't know what the ratio of men to women were. Usually in most yoga trainings, it's mostly women, right?
Yeah.
But I wasn't aware. So I wasn't sure. So I wasn't like, if I said no to a certain pose because I'm teamed up with a male, would they be okay with that? So there were lots of hesitation on my part, and they had an intro session, what do you call Valerie
like a
had
question and answer.
Exactly, a question and answer session. And after going to that, I felt a bit more comfortable that, okay, I think it's a safe space. And the beauty about yoga studios are we make a safe space. There's no judgment, right? We tend to have no judgment, and everyone comes with their own experiences and their own personalities and their own awareness. So, and I felt good when that was being honored, that was being appreciated and understood. And I was told, like, no, you don't have to be teamed with a male partner if you don't want to. If you want to opt out certain poses, you're welcome to. So that was really nice. That was really welcoming for a yoga studio. So I really appreciated that. And Valerie was one of my 200-hour teachers. So, and she's awesome. So it was a good experience.
Valerie Nopik, and future guest, be excited, people, future guest of the podcast, and a fellow woman of science too. So perhaps that was helpful as well.
Oh yeah, absolutely. That scene, she is a neuroscience, I believe, right? And so having her knowledge and her expertise and her openness, the way she, encouraged me in a very warm manner to be in the studio was very welcoming for a hijabi woman, right? And there were times, I must admit, I did take off my hijab because I wasn't feeling comfortable, or I was just too hot, or I didn't have the right clothes, right? And I felt, I would say, ashamed of myself. I did feel uncomfortable with myself. I had this guilt in me, but that was my journey as a hijabi woman, right? And now when I have to encourage young girls or older women who want to go into yoga training, I know what to tell them. I know how to dress, what to wear, what questions to ask, and it's okay to ask those questions. It's okay to ask for certain considerations. I didn't have that role model to say it's okay to ask for certain considerations to be made for you.
Yeah, it's a tough one because the yoga teacher training process often puts all of us outside of our comfort zone at one point or another, and it's kind of a part of the process. But for each of us to kind of figure out, where am I happy having my comfort zones challenged, and which lines are hard lines for me? Like where am I actually going to say no, and where am I going to say, okay, I'll give that a try and see how it feels. And I guess that's a different journey for each of us.
True. Having my own boundaries and knowing which boundaries I can push a little bit, right? Which one is okay to push. And, and I feel like I have put myself through this training and the 500-hour with Yoga Medicine for a purpose. I've not done this for nothing, right? It's a service. It's my seva. It's my call, right? I'm passionate about sharing things. I've learned one thing I think as yoga teachers, we learn about ourselves. We're passionate about sharing. If we learn something good, we love to share. Because if it benefits me, that means it will probably benefit you as well.
Or at least someone. So if we can reach enough someone's, yeah.
Exactly. And there's so much goodness in what we are learning. And it's something we teach. Sometimes it doesn't require anything to buy. It's just like something small you need to do. And at this very moment, you have this. You don't have to go to a 90-minute class. You can do this for 5 minutes and you'll be okay. Right?
100%.
So, yeah. And it's just like, so for me as a hijabi woman, putting myself out there in an uncomfortable space and learning where to push the boundary and be okay in an uncomfortable zone was a huge learning curve, and gave me the ability to just like break out of my shell, just like, I'm an extrovert, introvert, like people like to say, but at the same time, it did make me more confident as a person. It did make me, be able to exude a certain kind of confidence that I'm okay in doing what I'm doing without compromising my values. Right.
That's a powerful place to stand.
Yes. I don't want to compromise my values while I'm learning something.
Now, when you initially went into pharmacy, did you have this same interest in what we now call functional medicine and in all of the different tools that people could call upon to support their health? Or did that come later? Because I know that's something that you're interested in now.
It didn't. No, it didn't. In fact, pharmacy took me to holistic living in a sense that when I got into pharmacy school in my early 20s, and before that, I was a nutritionist. While I was a nutritionist, I became frustrated with helping understand people's mindsets and changing mindset. I realized I need to do a whole psychology degree,
So
and
true.
so, I think people know what to eat, what to do. It's just helping them change their mindset. And in my young 20s, and impatient I didn't really care for changing people's mindset. And I said, well, I'll just do pharmacy. I can't be bothered with nutrition. And I went to pharmacy school, not appreciating much about holistic living, to tell you the truth. But while I was practicing as a pharmacist, while I worked as a fellow in clinical toxicology at the New Mexico Poison Center, and I saw cases of overdose, young children overdosing because of societal pressure, whatever they're experiencing. Those little tiny stories of patients overdosing on medications, tiny stories of people taking wrong medications to treat an illness which they shouldn't have, seeing stories after stories of mismanagement of medications led me to question what is happening. Why are we resorting to medication when things go south, right? Why do we reach for pills every time when something happens, right? And people usually perceive pharmacists as advocating medicine, right? We are the ones wearing white coat. Hey, take this. Hey, you have constipation, take this. Hey, you have a headache, take this. And I didn't like that perception because I saw the other side. What happens when we mismanage our medications, right? I've seen like 6-year-olds, 7-year-olds, like almost near fatal condition because the parents decided to give them a bit too much of something, because they thought it may be good for them for a certain something, or they just overdosed, or a child, had access to a medication bottle and just drank it, and they ended up in hospital. So those stories, stories make us, right? Stories and experiences shape us. So my stories as a pharmacist, what I saw, shaped me to question what is happening. And that questioning took me to where I am today. It's like, hey, Mariya, you did a nutrition degree. Do you remember that? Like, oh, yes, I did. Okay, so go back to your roots, go back to where you came from. And I come from an Indian family, and we have so many holistic living practices that I didn't appreciate when I was young, right? The fact that my mom would take time out to drink tea in the evening. It was just her moment, her self-care, to drink a herbal tea, right? The fact they would take a siesta in the midday, right? It was just time for them to take 10, 15-minute nap, right? The fact they used herbs and spices in their cooking, right? The fact that they had a family time for meals. I mean, those are things that we appreciate as we get older. And when we are young, like, oh, mom's taking a nap again, or mom's, having a tea. And we don't appreciate those. But as we get older, we tend to appreciate them. And as I got older, I started piecing those little tiny bits of stories together. And I realized there is a wisdom behind why we all do all these things. And then my own personal journey, thank God I'm okay at the moment. But every time I would visit the doctor, they would say, oh, your blood work is fine. Everything is fine. But I would notice my blood values from previous year and the year before. And I noticed something was shifting,
trending
going more south, trending more south. And the trajectory basically wasn't in a good place, right? And so I thought to myself, are they waiting for me to have a diagnosis of diabetes? And then they'll say, okay, now you need to take a medicine, right? I need to fix this now. Because, coming from an Indian family, I do have my, family history of diabetes and heart disease. And so for me, having that nutrition background, the family background, pharmacy background, I knew what I had to do. I knew. And I know lots of people like me who are also probably on the same boat, right? And if I tell people, oh, well, I do monitor my my sugar load, I said, well, you look healthy. You're not overweight. Why do you need to do that? Right? It's like, because I monitor. That's why I'm
Yeah.
healthy weight.
And you've
right?
really hit the nail on the head, the strengths and the weaknesses of Western medicine. That sort of emergency context of Western medicine is so potent, and it's so helpful. I would, if I broke my leg, definitely want to go to the hospital, 100% want to go to the hospital. But for those lifestyle factors, the things that kind of creep up on us over the years, Western medicine is not so good, is it? It's not good until you hit the point of diagnosis, and then sometimes it's too late to do anything but go to your pharmacist and ask for the pill.
Oh yeah, absolutely. Like Western medicine is absolutely fantastic for broken bones, right? Emergency cases for appendicitis. You have an emergency, you've got it. But unfortunately, for chronic disease management, we tend to lag behind. It's because of the lifestyle we have. We have a high stressful lives, right? COVID didn't help us either. And then our dietary factors, we eat a lot more processed food. Even what we consider, unfortunately, healthy processed food is still processed food. We don't value sleep as much because of the invention of devices that we have, the convenience of mobile devices and streaming apps, Netflix, Hulu, whatever. And we becoming more nuclear families. We have become more isolated, and we'll have less attachment to communities. So all these factors are contributing to our health mismanagement, right? And so what my philosophy is basically, let's look at the root cause, right? Okay, so say you do have a history of heart disease in your family. What can you do now, even for a 10-year-old, right? You start young as possible. What can a 10-year-old do now to prevent a heart attack when they're 50? Right? And life stresses will come on. There'll always be something. We could be living next to a polluted water. We could be living an environmentally polluted zone. We could be living next to cables. We could be exposed to high EMFs, right? Those are things that we cannot control. I understand that, but there are things that I can control right now at this moment, right? I can control my sleep. I can control some of the stresses I have. I can control my diet. I can control my water intake. What few things can you do to control what can you do right now to help your situation?
Yeah. And I think that can be daunting, as you found when you were working in nutrition and nobody wanted to be told to give up alcohol or drink less or, eat less sugar. But it's also very empowering, isn't it? Because it means that there are things within your grasp that you can change, especially if you start with kind of low-hanging fruit and work from there. That can be really empowering.
Absolutely. Yeah. I mean, as a 20-year-old, I didn't appreciate that. Still, I'm making a difference in maybe 10% of the people, right? There's 10% of the people still willing to hear you and they would like to hear from you. I didn't appreciate that as a 20-year-old. I didn't appreciate the low-hanging fruit, right? I went for the bigger picture. You're ambitious when you're 20 plus, right? You're ambitious, right? And you're looking for the bigger fruit. I think there's like you said, the smaller things I can encourage people. As a pharmacist, I noticed like people would come to me, well, which is a good laxative to take? And I would tell them which good laxative to take is, but I would tell them, well, this laxative will only work if you drink lots of water, right? And which is true. Majority of the laxatives work really well if you drink lots of water. But there is a low water intake and there's more intake of sugary beverages, right? Then the laxatives won't work. You'll just have a very hard time still passing your stools. So, I mean, I find like telling people even the smallest information is useful, planting seeds in their mind, even though they may not probably listen to it. I find people come to me like 6 months later, like, remember you told me that? I started doing that now. It's like, ooh, that was a long time ago, but I'm glad you started. Right?
Yeah, I love that. I've experienced really similar things where planting a little seed to somebody who you don't even think has heard you, you don't even think it's registered, but sometimes it does. It finds its way into a little nook or cranny in their mind and then starts to blossom, and they might come back later and ask you. So I love that concept of just dropping little pearls of wisdom just in case. Can't hurt.
Yeah, you and I are seed planters.
As long as it doesn't require me to go
away.
outside. As long as I'm not gardening outside, I'm happy to plant mental seeds, not physical ones. Yeah. So perhaps we start to talk about your expertise of pharmacy. And I'd love to begin, if it's okay with you, by talking about what medications we should be aware of that might impact our ability to practice yoga and other movement practices safely. Because I'm sure there are medications that have impact on our, say, balance or coordination or our mental focus. What medications do we need to know about in that kind of category?
Sure. Firstly, I want to applaud Yoga Medicine for exploring this topic, because I don't think not many people explore this topic of what medications should yoga teachers consider or look at when they take in a new client, right? So I've had quite a few physical therapy sessions, and I noticed the medication intake form. So the intake form that you fill out, and there's usually like 2 lines. And I often think to myself, well, if somebody had a long list, how do they fill?
And how do they decide? What am I comfortable sharing and what am I not comfortable sharing?
Yeah, exactly. How do they decide, and how do they know what considerations do they need to take in place? Because usually it's just an intake form, and the next minute it's okay, come in, Miss Farooqi,
Yeah.
So, yeah. Okay. So things that as a yoga teacher should consider are, I think the biggest class is antidepressants, right? And firstly, before I think I should preface this talk. I don't know about in New Zealand, but in America, a high percentage of our population are taking antidepressants or anti-anxiety medications. And if somebody is coming to you with anxiety and depression, I want you to assume they're taking some kind of a medication. Maybe they're not comfortable sharing it with you. Even as a pharmacist, I have experienced people who are uncomfortable sharing with me the antidepressants because it's a taboo, right? Or I'm taking an antidepressant because it means I'm unable to cope with life, therefore I'm taking this, right?
Yeah.
So there is a judgmental bias, a stigma towards it, right? So with antidepressants, there is a lack of coordination. They could be, they have a inability to coordinate their movements. They could be sleepy, especially if they have started the medication within like 2-3 weeks, and the doctor told them, "Hey, I recommend yoga for you as well." And they're 2-3 weeks into their medications and they're practicing yoga with you, right? The energy could be low at that time. Their motivation could be low at that time. They may not be so willing to come on the mat. So arriving on the mat probably itself a big feat for them, right? And so having that compassion for them, that this is coming to the mat must have been very hard for them. Also, some tremor. You might notice some tremor if the medication dose is too much for them. With antidepressants, they might have some slight tremor. They may have some unstable gait. That's possible too. The other medication that I can think of that people often don't talk about is lithium. Lithium is a very old medication, often still prescribed for bipolar and bipolar depressive disorders. And with this medication, I'm very careful if I see a client of mine with this medication, because when they sweat, and say if they're not adequately hydrated, and when they sweat, they can have seizures. Okay.
Wow.
So, which is quite, which can be fatal. So it's very important for us, when I practice yoga with clients who are taking lithium, I often tell them, make sure you have water, you're well hydrated before you come to my class, and make sure you hydrate well after. And you are welcome to drink water at any point during the class, right? I have been to yoga studios where it was kind of discouraged to drink too much water, right? It's like, well, make sure you don't drink chugs of water, drink sips of water. I think that should be specific on the client themselves. I don't think we can put that restriction. Let them drink as much as they want to. They know themselves how much they need to drink. And so lithium, and then diuretics. So we call them water pills. Some people take them for maybe they have too much excessive swelling, or they have kidney issues, or they have high blood pressure, or some women take it for weight loss. So these are diuretic pills that help eliminate water. So you're taking diuretic pills to help eliminate water, and then you're doing yoga on top, or sweaty yoga or hot yoga, and then you are excessively sweating. So you're becoming pretty hydrated, right?
Okay.
So in these women, I usually recommend some kind of an electrolyte and water to help them. The other ones that I can think of are sleep medications. So sleep medications that I'm not talking about like Valium, the old sleep medications. I'm talking about the newer ones like Ambien, Sonata, Lunesta, the newer ones that are claimed to be taken as needed. But unfortunately, it's not as needed. People need them on a daily basis. Now, even though they not supposed to give you daytime grogginess, at some people they do. So they do wake up feeling groggy. So for those people, I don't encourage morning yoga because the coordination may not be the best. So for those people, excuse me, I recommend doing yoga middle of the day. And if they're exploring yoga, if the teachers want them to do yoga in the evening, I recommend more restorative yoga practice for them, because
so it's not
they
fighting
need to
that tendency to get sleepy.
Exactly, right? So when we wake up, our cortisol levels are high, which wakes us up, which makes us feel fresh, excited for the day. And as the day goes on, our cortisol levels go down, right? So I think for most people, a good restorative yoga practice is best in the evening, right? So you're not fighting that cortisol response. You don't want the cortisol to just go up in the evening. You want it to come down so you can have that natural sleep inducement, right? So for people, if you have a student or client who is mentions they have sleep issue or having hard time maintaining or inducing sleep or on sleep medications, so I would usually recommend them restorative yoga practice in the evening, and then more an upbeat yoga practice, perhaps a flow in the morning, right? In the middle of the day, sorry. What else? Allergy medications. The older class of allergy medication. And in some people, the newer class of allergy medication do also cause drowsiness, right? So again, the coordination is not the best, the gait is off, and they may have a hard time having motivation to practice yoga. What else can I think of? Anti-anxiety medications, of course. Now, these medications are taken throughout the day by some people. So like this, sometimes when they're prescribed for anxiety, it's like 3 times a day on as needed basis. And so what I find with these people is they tend to prefer a mellow practice. They tend to prefer a practice which is not too intense. And they do have issue with their gait, and that is a usually of concern. So I usually avoid balancing postures with them, like the tree pose or the eagle. I tend to avoid that with them because I don't want them to twist their ankle. The other class of medications that I can think of are antibiotics. And the 2 common ones are ciprofloxacin and levofloxacin. And they usually prescribed for pneumonia-like conditions. And they tend to have a tendency to cause tendon rupture. So any yoga practice that involves, like, you're moving from a lunge to a horse stance, like a quick movement.
High range of motion.
Sudden
Heavy
high
load.
range of motion. Yeah, high torque. Yeah. So they can rupture the tendons, especially in the Achilles area. So I tell them, well, I often say injuries happen usually during transition. Just be careful when you are transitioning from one pose to another pose. And I usually use that for people, even the elderly. I tend to be careful with my transitions with them. And what else can I think of? I think that's it. Now, of course, usually my recommendation to people, to teachers, yoga teachers who are doing the intake form, make sure your medication list, the column or the space you have, it's quite big.
More than 2 lines, please.
More than 2 lines, yes. And don't be afraid to call your pharmacist, your local pharmacist, your community pharmacist, give them a call or just go over and ask them, hey, I would love if somebody came up to me and said that, hey, I have a list. Can you just tell me if there's something I need to be worried about, concerned about, just starting an exercise regimen? And I just want to quickly go over. I can just quickly eyeball it and tell you, okay, yeah, this, right? So
I think that's fantastic advice, because firstly, you can't depend on the student themselves knowing all of the potential side effects. Often people, they're just taking what they're told to take and they don't exactly know what it is or what it's doing. And secondly, Google, surprisingly unhelpful when it comes to this sort of level of nuance. So that's great advice.
Yeah. So contact your local pharmacist or find a pharmacist friend, make friends with them.
Make friends with your pharmacist.
Make friends with your pharmacist, And
that should be an international day, shouldn't it? International Make Friends with Your Pharmacist Day.
Absolutely. Yeah. They could be they're a useful resource. They're a very useful resource. And use them where you can.
So you've kind of given really similar advice to those of us who are working with students one-on-one to take more time than we might normally, just as we would love doctors to do, to ask some broader questions and to see if there's anything there that sort of stands out, to kind of get a bigger picture of this individual, as opposed to just jumping to, we'll work on gluteus medius and that will improve your balance.
Yeah, I find, Rachel, that people love to talk, people love to share. The more open-ended questions you ask, the more open you are to their answers, they love to share. And the more you hear and the more you listen to them, you can get a bigger idea of who that person is. And it helps you. You don't have to be a medical practitioner, you don't have to be a pharmacist, but you get an idea of what this person is experiencing. And I've realized, especially with chronic pain management clients, is that the more you listen to them, the more you hear them, the less pain they experience, right? And so sometimes they need to be heard. So as a pharmacist, I can't really talk to them. Honestly, I can't really talk to them much about coming off pain medications because my job is to dispense. They don't want to hear from me how to taper off unless they're really interested. But as a yoga instructor, they're then interested, right? So
let's talk about that. I do want to be really careful to preface this conversation with, hopefully to listeners, this is obvious. This is a podcast. This isn't medical advice. This is general information. We're certainly not able to give anyone individual advice about their situation, and everyone should talk to their healthcare provider about their medication. But with that context in mind, there must be situations that you see in your experience where there's a potential for yoga practices to allow people to reduce some of their dependence on medication. And of course, not all people, not all the time. But let's talk about some of those situations where maybe there are little simple things we could do in our lifestyle that might reduce our dependence on medications.
Absolutely. I think it starts with, you have probably seen this, is listening to the story, empathizing with the pain, being compassionate and understanding that, yes, your experience is real, your pain is real. I appreciate that there is pain. I appreciate that there is something you're experiencing. I don't know what it is. I may not know what it is. I may not be able to help you fully, but I acknowledge there is something happening. I think that's super important. And I think that's one of the primary things they want to hear is that. And the perception of pain becomes much less. So they are able to manage pain when they know they're heard, they're being heard, and they're being seen for who they are. Now, there are plethora of studies, right, on yoga and chronic pain. There's so much work that is coming out, amazing work that has been coming out, that how pain threshold changes with more modalities such as yoga or physical therapy. And when I usually get a client who has experiencing pain, the first thing I like to do with them is to explore the breath with them, right? And even with my own children, with my own daughter, when she complains of pain or something's happening, I just ask her, how are you breathing? Can you loosen your jaw? Can you breathe through the pain? Right? This pain is going to go away. Yes, it's here for a few minutes. It'll go away. Can you breathe through it? Right? And sometimes just talking to them, hearing their story and doing breath work with them without moving anything else, right? I find that having a huge difference, right? And then, of course, there are various things that we can do for address each pain. But as a pharmacist, it really does break my heart when I see people using medication as the only modality for addressing pain, right? Because there's so much out there. There's so much science out there. There's so many resources. You can just watch a YouTube video and get help for your sciatic pain, right? Or piriformis syndrome, or whatever low back pain that you may have. This plethora of information. I don't think we can hide ourselves anymore and say, I don't know, I didn't have access to this. Almost everyone has access to some kind of resource. And so really breaks my heart as a pharmacist. And then there is the yoga modality, of course, so many things within yoga that we can put in our toolkit. And then there are dietary factors, which we can explore later, which can help with pain as well.
I love that because it really specifies arming ourselves with information, but rather than, just transmitting that information to the student, we plant a seed. Maybe that's something that you want to talk to your healthcare provider about. Maybe it isn't. In the meantime, what we can do today in your yoga session is, reduce the balance component, or we can go a little slower on the transition so that you have time to find your footing, or, whatever you're experiencing. We could do a little breath work to help you feel more grounded. So there are things that they can do in terms of managing the medication, but there are almost always things that we can also do on the ground in the moment to help people feel more comfortable and more healthy, more happy.
Of course.
Is there anything that I've missed? Anything regarding medication that you really want people to know or understand?
There are medications that affect gut health. So I do want to emphasize on this part, that when our gut health is affected, it affects our mental health, right? And if you have a client who is suffering from, say, anxiety or some mental health condition, it's often okay to make the link that their medication may be affecting their gut health, which is affecting their mental health, right? So I just want us to be compassionate with ourselves when we're teaching, that there's so much I can have, there's so much impact I can have as a yoga teacher. And there are things outside my control that I cannot do much about. So again, going back to our early discussion, letting them know, hey, I think this medication may be affecting your gut health. How do you know? How can a yoga teacher with no science background know a medication can be affecting the gut health? Look at the side effects, and if it says diarrhea, constipation, flatulence, things like that, Okay, it's doing something to the gut, right? And then when our gut is disturbed, so our neurotransmitters are not being made properly, we are not producing enough vitamins, our microbiome is disturbed, so the gut flora is disturbed. There's more of a bad bacteria or bad flora than the good flora. So we are unable to synthesize food, we're unable to break down food. That means we're unable to take the nutrition from food, right? The body launches an inflammatory response because it sees things that are foreign to them or things that haven't been digested. And so it launches an inflammatory response, and that inflammatory response is picked up by our vagus nerve. And, it sets off a cascade of events, right? And so, and for the client, that's very disturbing because they're doing everything they can, and they're coming to yoga class, they are taking their medication, they're eating well, but they have this, gut issue, they have this diarrhea, they have this anxiety, right? And so we can mitigate some of the effects, right? We can make some of it better. These people tend to be living in a hyper stress state. So there's a chronic underlying inflammation happening, right? So inviting their parasympathetic nervous system to come into play, as yoga teaches, that's important, right? We can do that. So, going back to pain, with chronic pain, there is some kind of underlying inflammation. With some kind of underlying inflammation, there's an immune system dysregulation. These are all connected. And as yoga teachers, we have a big part to play in calming down the immune system, right? More restorative practice. And of course, as teachers, we tend to practice where they're at, right? If they're at a hyper level, energetic level, we tend to bring them to that level and calm them down, right? Bring them to a more restorative pace. So showing them the benefits of having a yoga practice that is more restorative, more calming. I often find myself discussing with my clients like, well, I prefer Zumba because that's what my stress level is better. That's what I have. Like, yes, Zumba is great, but we also need to practice certain movement, whatever it is, to bring our inflammatory response down, our immune system, calm it down, reduce our cortisol levels. So there's a place for everything at the moment. So
I love that. I think you've brought out some really important things there. The first one being this vital link between gut health and overall health, not just physical, but mental. And I think this is something that a lot of people still don't quite understand. There's that feeling of, I'm me, I'm my bones and my muscles and my skin and my organs are something separate. But we're now understanding that we are more microflora than we are human cells. We have more bacterial cells than we have human cells. So there's no way that our gut health couldn't also impact not just our physical health, but our mental health. And hopefully that information will get out there more and people will understand more that the way that I'm feeling maybe isn't just from stress in my life, but actually could be from the medication that I'm on impacting my gut health. Maybe there are some things I can do to boost my gut health. So I love that you brought that up. And then secondly,
the things they can, sorry.
No, go for it.
The things they can do if they're taking medications that are impacting the gut health, they can eat more foods that are rich in prebiotics and probiotics, right? So I usually encourage people to eat whole fat yogurt with no added sugar. It could be kefir too. Probiotics like kimchi, sauerkraut, pickles, right?
Favorite fermented foods.
Flavored fermented foods. Fiber. Load yourself up on fiber. Fiber is a great prebiotic. So I'm talking about like asparagus, celery, jicama, fibrous vegetables. Go for it more. So there are things sometimes, as we said earlier, that sometimes medications are needed, right? And And if you have to be on those medications, there are things you can do to help yourself, right?
Mm-hmm.
And the hope is eventually, perhaps, maybe you will come out of these medications. The aim should be that. Unfortunately, I feel like people think if they're taking antidepressant, they're on it for life, right? Right now, I want you to consider this antidepressant is for me for this till I establish other practices, till I establish what's happening with me, till I resolve the underlying trauma. I'm going to explore the idea of medications as well as other things, and hopefully I'll come off it.
Mm-hmm. And it might just be that that's the tool that you need to get you to a place where you have the capacity to seek out other tools to add into your toolkit.
Absolutely.
But it isn't necessarily forever.
Yeah. Our job is just to empower them. Like, you can do it. You're capable of doing this. And you're not stuck with this one medication. You have many more possibilities.
I love that. And then the other thing that I wanted to draw out from what you spoke about earlier was this huge global influence of the central nervous system. So whatever's going on medication wise, there are still levers that we can pull by either upregulating the nervous system, but as we spoke about more often, down-regulating the nervous system, helping people to feel a little more calm and a little more tranquil. And sometimes that does mean meeting people at the level of a Zumba class and giving the energy an outlet. But hopefully there is a tail end where we're able to bring them back down to slower breathing and softer gaze and the world moving at a slightly more gradual pace.
Yeah. That is so hard to convey, even for me as a yoga teacher, to help them appreciate that. But I feel like people don't see the benefit till they start experiencing it. So, I myself was like that once, right? I feel like in my 20s, I need high, type A personality. You need to get things done, and I need to move things. And for me, a slow movement practice like yoga would not have been okay. And I have to honor that. I have to honor that in them, that this is where they at, and they will meet me, and I'm available for them when they're ready. And but when I talk as a pharmacist, when I talk to my customers, and I just say, make sure you relax. Okay, make sure you drink your tea. I don't have to say the word. You need to relax. Some people don't like, well, am I not relaxed? They become defensive. I just say, make sure you have time with your family. Make sure you drink tea in the evenings. Make sure you do something for yourself. That hopefully will induce some natural relaxation cascade.
I like that. I like the space that you have created for people to define what relaxation means for them, because for some people, maybe that isn't time with their family, or maybe that isn't a cup of tea, but whatever it is that constitutes for you, a little quiet time to yourself to kind of check in and see how you feel. I love that. Yeah. There's one more thing that I wanted to talk to you about today, and that is something else that our listeners might be interested in, the Yoga Medicine Seva Foundation. I saw a post of yours that was really moving, where you were dedicating your fundraising effects to the memory of your father. Is there anything that you want to talk about there with the meaning that the work the Seva Foundation has for you?
Well, Rachel, frankly speaking, when I look at those girls, I see myself in them. And I say to myself, what is so different between them and me? Just because I grew up in a privileged home, I was born in a privileged house. My parents had means to not sell me so I just see myself in those girls. And when I look at my childhood pictures, I could have been easily them. And my dad was a big advocate for girls' education, and he came from a family that had difficulty making daily means, but at the same time, they valued girls' education. They knew the importance of girls learning and going further. And my father migrated twice. And he, talking about stepping out of uncomfortable zone as a yoga teacher, he stepped out of his comfort zone twice in his life. Once from India to Saudi Arabia, where he didn't know Arabic. He didn't know anything about Saudi Arabia. He was, I would consider, an economic refugee. So my mom became pregnant with me and he moved to Saudi Arabia to get better life for himself. Then from Saudi Arabia, he realized there's no higher education prospects for his two daughters. Then he moved to England, and he left his a job that he was very happy at, and he moved to England. And that's when his health, migrating twice by the age of 45, I think is quite
stress.
Hard.
Yeah.
Yes, it's quite traumatic, I think. And so that did have a toll on his health, and he passed away from complications of diabetes. So, and I knew when he passed away, Rachel, after he passed away, we would hear from people the money he would donate to foundations or gave money to people privately. And we had no idea. And we had no idea that he did that, right? And majority of those donations were to education centers, education groups, or for the sake of educating a girl or a boy. So he was an architect himself. And he had a hard time putting himself through school. So he kind of empathized with those causes. So, and he always pushed my sister and myself to do more and more. It's like, he was, okay, so when's your master's? When are you doing this? Or when are you studying that? It's like, Dad, can you just relax?
Let me breathe.
Let me breathe, So he was always pushing us. And I really appreciated, of course, in your 20s, you don't appreciate that. Back to my naive 20 self. But as I'm maturing, as I'm a mother of older kids, and I'm appreciating the sacrifices that he made, and he would have really loved to contribute to Yoga Medicine Seva and the great work the foundation is doing, the fact that they are taking kids off the street and giving them hope. I mean, that's what I would want if it was my daughter or myself, right? Just give me hope. I will do the rest.
I'll do the rest.
Some hope.
Give me hope, some education, and I'll take it from there.
Yeah. Those girls are very capable. I'm very proud of them.
Well, that's a really beautiful testament to your father's legacy. I love that. And I think that will hopefully inspire a few people to get involved with what the Yoga Medicine Seva Foundation are doing to make a really concrete difference to the lives of women and girls. Well, yes. To wrap up, let me just ask you, for listeners who are interested in you and what you do, where would you send them?
Well, I'm quite active on my Instagram. I'm not so active on Facebook. And I do have a YouTube channel, very bare minimum. And LinkedIn is another one. They can reach out to me on LinkedIn, on Instagram. And Pharm.D, the company I work with as a functional medicine practitioner. And they can book a free consult with me if they like.
We'll link to them in the show notes. I highly recommend a follow on Instagram. Lots of really solid, practical, real world, real life advice there. So thank you so much for sharing your time with us today. I really appreciate it.
Thank you, Rachel. It's been a delight. Thank you.
Thanks for listening to Yoga Medicine. If you liked the show, be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you got something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com. Check us out on social media as Yoga Medicine, or you can email us at info@yogamedicine.com. Thank you for being part of our Yoga Medicine community.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.